Well, now we know only 1 out of 10 Americans want it, and now Republicans are fighting to delay it. I am talking about the individual mandate in the president's health care law.
Individual responsibility requirement is what it's called.
Mandated by the government. That's not individual responsibility or individual liberty.
Just like
that's socialism.
Require that you get car insurance.
Late before a holiday weekend, the administration on a blog post essentially whispers, "It's not working. Oops. This is a mess."
And we don't know tomorrow. What's the next shoe to drop? What else are they going to hold back on?
I don't know how you can conclude that this is not a total fiasco.
Well, is all this kind of stuff the law's final blow or a slick trick by some Democrats to prevent it from getting blown up? Welcome, everybody. I'm Neil Cavuto, and a new poll finding just 12% of Americans want the individual mandate to kick in next year. That provision in the health care law that would force Americans to get health insurance or pay a fine. This after the White House delayed a similar provision for large employers. Pennsylvania Republican Congressman Mike Kelly says not only is that not fair, but this whole law just ain't looking right. Congressman, good to have you, but it does seem to be imploding. What do you think?
Well, you know what, Neil? I mean, it is. It's unraveling right before our eyes. We're watching it day after day, and it just doesn't make sense. I struggled last night. I read through some testimony. I'm trying to figure out how in the world, and I wasn't here when they passed it, how in the world did they ever think it was going to work from day one? And this was passed with such great fanfare. But all of a sudden, you know, we're eliminating certain pieces of the president's deciding what to enforce, what not to enforce, what does he like, what doesn't he like, what's palatable, what's not palatable. And he does it in a way that I don't think makes sense. If he wanted to do this, he should have come before the American people and said, you know what, my bad. We thought it was a good idea. It's not working out. We're going to work on this. We're going to repeal it. We're going to hold it back. Just holding it back doesn't fix it, Neil. It just pushes it to the back burner. We need to get this pulled back off, repeal it, and replace it with something that makes sense and is fair to the American people. Isn't that what we want?
But you know, Congressman, here's where you and some of your colleagues confuse me, because I understand what you're saying, but many of your colleagues were using the law itself as an excuse for not changing the law, saying that once it's a law, the president has to effectively go back to you guys, Congress, to change, in this case, delaying a key provision like the insurance mandate. Now you seem to be saying what you do for one, you ought to do for the other. So if you're going to delay it for their bosses, you got to delay it for the workers. So I'm confused.
Well, I don't think there's anything to be confused about. The law is there. It's been put in place, and we know that, okay? There are certain things we can do. We've been able to defund certain parts of it that have been able to slow it down. But overwhelmingly, you know, we're seeing more and more people are saying this isn't going to work. Now, because the president did what he did, now we're looking at it and say, listen, so if you can pick and choose, you can say we're not going to enforce the employer mandate, but we're still going to do the individual mandate.
So you're saying
if we're talking about treating people fairly,
push back the individual mandate to be fair, but you're not going back to what some of your colleagues were saying yesterday. No, the law says you can't do anything, individual or employer mandate, without going through us first.
Well, what I'm saying is, you know what, suspend this whole process. Let's go back and fix this. It can be fixed. We've got to do something that takes care of health care in this country. We all agree on that. This just isn't the way. And the way it's unraveling right now, it is drawing a wedge between the people and the government. And again, it destroys the trust that people have. We've got to do something. We have a responsibility to do something that makes sense, that's fair for the American people. And this is not fair. This has nothing to do with Republicans or Democrats, by the way. This has to do with fairness. And this has to do with taking care of the American people and fulfilling our pledge to them. So whatever the process is, and I know that there's confusion on that from time to time, we're looking at a piece right now that's a law. It is a law. The president has chosen to not enforce one piece of it. There's an individual mandate out there that people overwhelmingly don't think they should have to be forced to buy this health insurance.
So it's good
we're
for,
do
it's good for the
back.
bosses, ought to be good for the worker bees. All makes sense. Congressman, thank you very, very much.
Thank you, Neil.
Well, now to the woman who says she knows what the president is really up to. This mandate deal really isn't about helping employers. Betsy McCoy says it's about saving those precious exchanges. Betsy, what do you mean?
That's right. This was a ploy to drive healthy, younger people who are working into the health insurance exchanges, and that's exactly what it does. This isn't a victimless crime, by the way. Of course, it tramples the Constitution, but in addition, it impacts 10 million workers and their dependents. 10 million workers who are currently working full-time, they're uninsured or inadequately insured, and come January 1st, their employers would be subject to the mandate. So they would have gotten health insurance.
Right.
But now they're between a rock and a hard place. They're going to have to pay the $95 per person first-year penalty for being uninsured, or they're going to have to go to the insurance exchange, and that's exactly what was intended. Kathleen Sebelius, Secretary of Health and Human Services, tried to get the NBA, the NFL, other sports groups to lure young, healthy, working-age people to go into the exchanges. And when they refused to shill for the health insurance exchanges, they postponed the employer mandate, giving these 10 million workers virtually no choice except to sign up.
But it sounds to me like the exchanges are nowhere near being able to be up and running, and this was an acknowledgement of that with delaying the corporate mandate.
That may be.
But where is it going? Where do you think this is going?
In addition, let me point out that the taxpayers are victims. Delaying the employer mandate for 1 year is going to cost $60 billion. $60 billion. It's the $10 billion in foregone employer penalties. But in addition, every person who signs up for that subsidized exchange coverage, it's according to the CBO, Congressional Budget Office, it will cost $4,820. So even if only half of those 10 million workers and their dependents sign up, you've got a bill of over $48 billion right there.
Wow.
Add that $10 billion on. Do you realize, Neil, that's more than the entire cost of major federal programs like the Medicare Part D drug benefit. And yet the president, with a snap of his fingers, decides to tweak a law and not enforce part of it. Clearly a blow to the U.S. Constitution and taxpayers.
I don't think, and I'm no lawyer, but I don't think this thing is going away. Now, they might try to choke the funding of it. They might try to delay provisions. The Republicans might go back and forth on ways to sort of force the president's hand. But it's such a monster, and I think it's going to be hard to unravel. And I know, as you know this a little better than I do, there are provisions in there where if the cash isn't coming from these younger workers or these low-wage workers who are apparently finding it's too expensive to sign up, and you know the very uninsured who we upended our entire healthcare system to make sure they signed up aren't signing up, there are ways they could sneak taxes in there, Medicare surtaxes that are already high. On top of that, and there are those provisions in there that will allow them to find other ways to raise money for this that we might not like.
That's right. Clearly, with this move paid for, this is a real budget buster.
Okay, well, that wouldn't be the first time that's happened.
That's true. But in addition, this is not the first time either that the president has simply ignored the written law, defying the Constitution, and picking and choosing which parts of a law he will enforce. And I should think that members of the House of Representatives would call him to task for failing to observe his oath to uphold the Constitution.
Betsy, always good having you. You've been all over this long before anyone. Betsy McCoy. She read this thing and actually memorized. It's like Rain Man. She just
Section 1513. He's got to enforce that employer mandate.
Don't even get me going on 1513, Betsy. I'll be here all day. What the hell is she talking? Anyway, from a healthcare law that is gasping to a widening